Dr. McDougall was kicked out of the Obesity Medicine Conference in San Francisco. Seriously? Why? Okay, so who's John McDougall and why is he such a bad boy? John McDougall is a medical doctor in Northern California. He's a best-selling author and he runs a clinic, a lifestyle and diet clinic in Northern California. He's an expert on obesity and disease intervention through diet and lifestyle modification. That doesn't sound so bad. Being an expert at conquering obesity, it's no surprise that Dr. McDougall was invited to speak at the Obesity Medicine Conference. Here's the program for the upcoming conference. And you can see that on this particular day, they've set up to have 3 experts come talk about treating obesity using 3 different dietary approaches. One doctor is set to talk about the Mediterranean diet. Another is going to talk about using a low-carb, high-fat diet to tackle obesity. And Dr. McDougall was going to talk about using a starch-based vegan diet to combat obesity. So far, so good. So a month before the conference, the Obesity Medical Conference people required that all the speakers submit their slides and videos and anything that's part of their presentation for review. So they reviewed Dr. McDougall's presentation and they decided, you're not welcome here. Basically, they told him, no f***ing way. Understand that Dr. McDougall's documented success in reversing obesity has been by using his low-fat vegan diet. This is a diet which mimics the diet of cultures around the world who don't have any obesity and who don't have many of the diseases of obesity which we see today. So what was so offensive? Well, one of the big objections I understand to Dr. McDougall's presentation is that he had a video to point out the fact that many of the experts and doctors who are promoting these low-carb, high-fat diets are themselves obese and overweight. Oh, my goodness. It seems like a fair point to me. Why would you take advice from somebody about losing weight who can't seem to do it themselves? Well, I might think it's a valid topic for discussion. The Medicine Obesity Conference people said, no way, shh, we're not going to talk about that elephant in the room. La 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 la. So let's look at this Obesity Medicine Association and really, who are they? Well, we can see here their slogan is, recognizing obesity as a disease. You may know that in 2013, the American Medical Association members voted to make obesity a disease. So what that means is when you go to the supermarket or you go to the movies or you go to the park, you go just about anywhere, you are seeing a lot of people with a disease. You're seeing a lot of heavy, big people, and you know those people have a disease. What does having a disease mean? It means you need to go to the doctor. You need to get treated. So if obesity is a disease, how do you catch it? And can you pass it along to someone else? Or what is a disease? A disease is like cholera. Cholera is an infectious disease, highly infectious disease, and we know that cholera is caused by water that has feces in it that people are drinking. And there's a treatment for people with cholera. You give them medicine, you rehydrate them, and hopefully they get better. But a lot of people die of cholera. But when you know that there's cholera, you know there's a source of the cholera. And so doctors and medical teams go and they find, where is this tainted water? Where's the water that's causing the cholera? We got to clean that up, get rid of it, and then there's going to be no more cholera disease anymore, right? So the Obesity Medicine Association should theoretically be doing the same thing. Just like cholera, you go find the cause and get rid of the cause. They should be looking for the cause of obesity and stamping out that cause. Is that what they're doing? Let's take a look. Looking at their conference, it becomes very clear that they're not focused on this. They're focused on recognizing obesity as a disease, but they don't seem to be focused on finding the source and stamping it out. Now, when something is a disease, medical doctors need to attack it. Insurance companies need to cover it. Drug companies need to make drugs for it. And the whole machine that's modern American medicine has to kick into gear. Let's take a look at why this conference, how this conference is being put on. Who's the people that are paying for this conference? Well, when we go to the sponsor page, we see that, well, it seems to be drug companies who have expensive prescription obesity pills to sell. It's OptiFast. It's a company called Robard. They describe themselves as leaders in weight management, and they sell protein milkshakes and diet gimmicks. It's even Care Credit, which is a financing company, a medical financing company that helps people afford surgeries and things like that, like a bariatric surgery. Looking at their program, you can see what it is they're pushing. They're pushing low-carb diets, which are actually very dangerous to your health. They've got talks about pharmacotherapy, behavioral and psychosocial treatment of obesity, pathophysiology, whatever that is. Here's a talk on insurance reimbursement for treating fat people. Here's another one, the art of attracting and retaining patients to your obesity medicine practice. Now there's an important skill to learn. Emotional brain training and endoscopic bariatric therapies. That's a surgery to reroute your intestines. So clearly they're not going after the cause of the problem, and they've kicked out the one guy who for decades has acknowledged that issue, Dr. McDougall, and that's the food. The cause of cholera is this dirty, poisonous water, okay? Let's get rid of that water and then people won't get sick anymore. The cause of obesity is this dirty food that people are eating today in the last 30 or 50 years. Get rid of that food and go back to the food that we thrived on, and you get rid of the obesity problem too. It's pretty clear. But people aren't really diseased. People are having a normal, healthy reaction to the food that they're eating. They're eating the food, all these concentrated calories, they get stored. The body is working the way it's supposed to work. The problem isn't with the people. The problem is with the food, the fuel that they're putting into their bodies. But in fact, I think that the conference was right to kick Dr. McDougall out.
You're fired. You're fired. You're fired. You're fired.
This is not an honest place. This is not a place that is seeking truth. This is a greed-driven, money-driven way to, make money from insurance companies and out of patients to give them quick fixes and gimmicks that aren't really going to solve the problem at all. But they're going to keep the patient coming back again and again. The easiest way to get people to keep coming back is to not address the source of the problem. So the problem that Dr. McDougall has is that he realized the emperor has no clothes. They didn't like that, so he's out of there. Ka-ching, ka-ching. All right, see you next time.